And now, the Channel 9 Action News.
With James Westfall.
And Marjorie Stewart Baxter. And our reporter in the field, April O'Neil. Next time, you drive the van.
But on a more serious note, the local community has seen a rise in incidences of necrotizing enterocolitis, a potentially deadly complication which affects premature or susceptible infants.
For more on this story, let's go to our field reporter, April O'Neil. April?
Thanks, James. I'm here with Pam Poovey, a local mother whose newborn has recently suffered from necrotizing enterocolitis. Pam, what did you notice was going on with your baby when you decided to call the doctor?
Well, you know, my baby was born a little early, but fortunately we were able to take her home with us when I went home, and we were home just a couple of days when I noticed that she was getting very lethargic, very tired. Her belly got real poofy and big, and that what really worried us was when she had vomiting, this weird color, and then she also had some blood in her stool when I checked her pamper. So we decided to go to the emergency room at that point.
That was probably a good call. Back to you, James.
You're on air.
Oh. And now back to April O'Neil with Dr. Kenneth Noisewater Acula. April?
I'm here with Dr. Kenneth Noisewater Acula, a pediatric gastroenterologist who specializes in the diagnosis and treatment of conditions like NEC. Dr. Acula, can you tell us what exactly NEC is and how it presents in the affected children?
Unfortunately, the cause of this disorder is still unknown, but it is widely thought that a decrease in blood flow to the intestines causes the bowels to stop producing protective mucus. Without this mucus, the tissue becomes necrotic and dies. This death causes the tissues of the intestine to fall off. Premature delivery and use of concentrated formula in lieu of breastfeeding are two common risk factors. Treatment includes antibiotic therapy, total parenteral nutrition, which is IV nutrition, and the removal of the necrotic tissue. It is my hope that future research will shed some light on this situation and we can break new ground in the field of necrotizing enterocolitis.
Thanks, Dr. Acula. Back to you, James.
Thanks, April. Earlier today, our intrepid reporter, April O'Neil, interviewed a local nurse about necrotizing enterocolitis. Let's roll that footage.
I'm here with Jake Westfall, a nurse at a local hospital. Tell me how the nurses are handling this on the floor.
Well, April, we like to encourage the mothers to breastfeed. It's something that we like to detect early, and when we treat it, we're going to treat it with IV and parenteral nutrition. We're going to monitor the I's and O's, how much the baby takes in and puts out. We're also going to watch for feeding intolerance. If the baby's having trouble feeding at the breast, we're going to need to maintain the fluid volume. A lot of times it's caused by some scar tissue, and that's a surgical problem that the surgeons can take care of. Basically what we're going to teach the parents to do is to make sure that the baby gets enough fluid, and when they go to sleep, make sure they put them on the side. And that's really about all we can do, other than educate the mothers.
Thanks, Jake. Back to you.
And that's it for us here at Channel 9 Action News.
Be sure to tune in tomorrow for a special report. Zombies! Fearsome flesh-eating menace? Or cuddly cure for cancer? You be the judge. I'm James Westfall.
And I'm Marjorie Baxter.
Thanks for tuning in.
And that's how the cookie crumbles.
You're on the air.
And now back to April O'Neil with Dr. Kenneth Noisewater Acula.
You just say April. April?
Next time, you drive the van. Next time, you drive the van. Elephants.
But
Nope.
I'm here with Dr. Kenneth Noisewater Acula, a pediatric gastroenterologist.
Nope.
I'm here with Dr. Kenneth Noisewater Acula, a pediatric gastroenterologist. I'm here with Dr. Kenneth Noyeswater Acula, a pediatric gastroenterologist who specializes in diagnosis and treatment of conditions like NEC. Doctor.
Unfortunately, the cause of this disorder is still unknown, but it is widely thought that
Hold on, am I starting?
Yeah, you're the thank you. Or do you want to end?
She said,
A wrap for us here at Channel 9 Action News. I'm not ready. For us here at Channel 9 Action News.
Be sure to tune in tomorrow night for a special report. Zombies, fearsome menace, or cuddly cure for cancer. I'm James Westfall.
I forgot who I am.
This is Marjorie Stewart Baxter. You stay classy.
I'm here with Dr. Kenneth Noyeswater Acula, a pediatric gastroenterologist who specializes in diagnosis and treatment of conditions like NEC. Dr. Acula, can you tell us what exactly NEC is and how it presents in affected children?
unfortunately the cause of this disorder is still unknown, but it is widely thought that a decrease in blood flow to the intestines causes the bowels to stop producing protective mucus. Without this mucus, the